Hello everyone, I'm sitting here with Christos Krasidis from Cyprus, and today I would like to talk to you, Christos, a little bit about Testing Week and why you think that Testing Week is a good idea, if you think that Testing Week is a good idea at all. And what is your involvement in Testing Week, your personal involvement and also your organizational involvement? And how are you, first of all?
Yes. So I'm Christos. I come from Cyprus, and I'm a member of the board of the AIDS Solidarity Movement Cyprus, which is a non-governmental organization registered in Cyprus in 1989. So it's the oldest one we have right now in Cyprus. And only recently we've started the CY Checkpoint, which is the Center for Prevention and Testing for HIV and other sexually transmitted infections. I'm also we are a small organization in a small country, so a lot of us are doing a lot of things at the same time.
Yes.
So I'll be speaking with a lot of hats. I'm a human rights activist with a specific focus on HIV and AIDS and on the LGBT rights in Cyprus and hopefully outside Cyprus as well, abroad. So why the European Testing Week is very important, because actually the first time we participated in the European Testing Week for HIV and hepatitis was in 2015. So this is going to be the third year in a row that we participate in the European Testing Week. And to be honest, it was a turning point for us, because it was the first chance that we had and a very good frame to present to the island and to the Cypriot public what an HIV rapid testing is, how can someone get tested anonymously, rapidly. It just takes 10 minutes,
Right.
and in a very friendly, community-based way. This is very important because up to that point, the only place where someone could get tested were the public hospitals,
Right,
the specific points that the public hospitals were allowing free testing and anonymous testing, but it was done through a normal test which took blood and took days to get the results. So this was the first time that the people in Cyprus were had the chance to attend to something quick, something very friendly. The environment is because exactly it's community-based and peer-to-peer testing. We follow the guidelines of the checkpoints around Europe. We did get a very good training from after partnering with the Association of People Living with HIV in Greece, Positive Voice, and the Greek checkpoint. So we are following their model, which was it was referred to as best practices by the World Health Organization. And to be honest, I was overwhelmed with the reactions we had. Nobody expected that the people would be so would embrace these efforts, would attend to these places. We have been doing testing since the European Testing Week in 2015 in various places, various venues. We do outreach testing. We go and set up a tent or a room in a nightclub or in central points in different cities in Cyprus. And I think the European Testing Week in 2015 was a turning point because it not only it allowed us to offer that to the Cypriot public, but also to convince us of the importance of testing.
Right. Let me interrupt you just a little bit. because it's extremely interesting what you say, that you work together with Positive Voice, so community organization in Greece, and of course it's very good if we can encourage this cooperation across countries and organizations. But have you received any practical help and support from Testing Week, from the organization of Testing Week? Were you using their materials or their publicity stuff, anything, any kind of support?
Yes, we are using all the tools that the website has.
Mm-hmm.
We've registered the organization and the CY checkpoint on the website. We've used all the tools that are around. We try to make them in Greek and add a bit of a touch that would help Cypriots engage to it as well. We are, for example, we use the logo of the European Testing Week for HIV and hepatitis, and wherever we announce it publicly and we promote the testing, we mention the European Testing Week, and we added the slogan, "When did you do it last?" which is a clever wordplay, let's say, for people to realize that they need to get tested, and even if they did get tested, they should get tested again and again and again.
Yes.
So the European Testing Week was very helpful. And Tamas, is a very good opportunity for me to mention that a couple of weeks ago in September, the European Testing Week mentioned the testing, our participation last year in 2016, which was the second time, as a success story.
Oh,
so
really?
one can go online. Yes, so one can go online on the European Testing Week website under success stories, and I would like to stress out that because we are a small country and a small organization, we could not have done it without partners.
Right.
And it's not only the Positive Voice and the Greek checkpoints, but we also had the support of the Ministry of Health in Cyprus. And we've also partnered with a number of other NGOs. For example, the Accept LBGT Cyprus, which is the LBGT organization in the south part of the island. Okay. With the Cyprus Anti-Drug Council, we have worked together. Also with the Cyprus Family Planning Association, which is the oldest organization, more than 40 years, that is making efforts to raise awareness around generally sexual health. And now we are working very closely together with Queer Cyprus Association, which is the LGBTQI+ organization in the north of the island.
Well, this is
so.
Actually, I mean, I'm sorry about interrupting you, but it's. I mean, I find it absolutely amazing because it's a very small community. So, do you? I mean, who are your primary clients? Who would go get tested during testing week? Is it
for the
it
testing?
Only,
you mean, right?
Yeah. Is it only MSM, like gay people, or is it other groups of substance users? Perhaps, I don't know. I'm really curious. Who are the people who come to you for testing?
Okay. This is I will need some time to explain you because it's a bit complicated for smaller communities. We've seen the statistics of the new HIV cases rising in Cyprus as well, like in Europe. And specifically in Cyprus, there is a rise in the gay community, and especially regarding MSM, men who have sex with men, either they identify themselves as gay people or not. Of course, we have been trying and we have been working with organizations to reach other populations as well, like sex workers, migrants, people injecting drugs. We've even made efforts to approach them, people in the public jail, and especially for MSM, which is the main focus we have right now, because this is where the rise is happening. We know that in Cyprus there is a big part of this community that is hidden. You cannot easily find them because there are people who either they don't identify themselves as gay, which means that they don't go to gay venues, they don't go to gay clubs, they don't go to gay saunas, where we do the testings as well, or we're talking about people who are in the closet, they are married or they are single, but they don't have the strength, the personal strength to realize and express their sexual orientation. And of course, their gender identity. We do have a trans community as well. So our efforts are focused on MSM. We are approaching other groups, which are more vulnerable groups because of the sexual practices. But we do include testing locations in central points of all the cities in Cyprus, at least in the south so far, because we want to be approaching the general public, and within them to reach people who are not comfortable coming to gay venues. So there is a focus, but it's the testing is not just for MSM; it's for everybody who has sexual activity in Cyprus.
Yeah, that makes sense. So if I ask you about one key message for testing week, for this year's testing week, what would that be in your view?
Okay. We are very focused on reaching the 1999 target, and so we realized that we have a very good result when it comes to the second 90, which is the people who are diagnosed and they get treatment and they have access to treatment.
Yes.
But that doesn't mean that the first 90 is reached. So that means that the effort should be made to reach as many people possible, to have them get tested, to convince them that it's safe and the procedure is very discreet, and that they should get tested. You know, Thomas, we have people coming, sending us messages or connecting with us and telling us that some of the fears that these people have is that if they are seen getting tested, that means they have sexual activity. That means they have sex. So
it is
at which point we are.
Yeah. So it is about stigma still.
The message. Yes, the message is not only for HIV, that stigma for HIV positive people, is also for testing itself.
Right.
So the message should be get tested. Yeah. No matter who you are, where you're from, how you identify yourself, get tested at least once a year. And we've created this wordplay also. In Greek, we call it sexetasou, which is a wordplay for getting tested for STIs and that comes from sexual activity. So it's sex exetasou. Exetasou means get tested. So that's the message. Get tested.
Thank you.
Know your HIV status.
Thank you, Christos. That was very convincing. Thank you.